Good afternoon. We are excited to have Rochelle Minanto-Pileska as our presenter today. Rochelle holds a master's degree in international public health from Tulane University in New Orleans, and her past experiences include work as a Peace Corps volunteer in Gambia, West Africa, as well as 7 years working for the American Red Cross in various management positions. Rochelle currently serves as Director of Education and Outreach Programs with Sustainable Resources Center, or SRC, and she's been there since 2008. She leads the lead poisoning prevention and training program, and her responsibilities include community-based screening events, in-home visits, referral for lead hazard control services, and lead and healthy homes training. Today, Rochelle will be presenting on a unique project she was part of titled Creating a Circle of Support for the Management of Asthma in Children. The goal of this program was to reduce the impact of asthma on school children and to improve children's success in school by providing cultural support for children with asthma and their families, improving communications between parents and the school, and when needed, provide home visit to reduce or eliminate triggers of asthma in the home. Without further ado, I will hand it over to Rochelle to describe this project, her successes and challenges she and her colleagues found as part of working to improve outcomes of children with asthma. Rochelle?
Great. Thank you, Kathleen, and thanks to the Minnesota Department of Health Asthma Program and the American Lung Association. I'm honored to be here. Let me just start with an overview of SRC. Our mission is to create healthy and safe and energy-efficient home environments. Let's see, we'll get this to the right slide. There we are. Okay, very good, thanks. We started in 1977, so we've been in business for 40 years. Currently, we have 26 employees, and we partner with organizations and communities to conduct residential assessments, interventions, education and outreach, and healthy homes trainings. Our primary area is Hennepin County. However, we do provide some services to other counties throughout the state of Minnesota. We specialize in 5 programs. Our first one is the Low-Income Weatherization, where we are the largest Department of Energy Weatherization Action Partnership Service provider in Minnesota. And we also have the largest and most certified low-income energy auditors and inspector team in Minnesota. The Weatherization program primarily conducts whole house energy retrofits. And what that does is it includes air sealing, wall and attic insulation, furnace replacement, ventilation, etc. The goal is basically to be cost effective and increase energy saving measures for homes. And lastly, our staff are all held to strict health, guidelines and health and safety standards. Our second program is lead testing and remediation, and that's where we work with Hennepin County to administer lead hazard control grants, also known as the window grant program, and we replace old windows that are chipping and peeling paint, one of the primary sources of lead, in order to protect children from lead poisoning. We also have licensed lead risk assessors that conduct assessments using the paint inspection and risk assessments. The program that I'm responsible for is our lead education, outreach, and screenings. We offer free in-home visits to identify lead hazards and assist families to enroll in the lead hazard control grants. We also have community-based testing events, lead testing events, where we have our Lead Yeti van, our big orange van, and we offer free lead testing, capillary tests. We get the results within 3 minutes, so we can definitely help with other referrals if needed. In fact, I just want to put a plug in here. We have 3 events coming this weekend, Friday, Saturday, and Sunday, that we'll be attending and offering free lead testing with our Lead Yeti van. So check out our website for more information there. In addition to the lead testing events, we have audience-tailored presentations, puppet shows, and attend any health booths that are out there in the community. And lastly, we offer lead and healthy homes classes. This picture below here shows a picture of our last year's National Night Out event at Oak Park Center in North Minneapolis. So with HUD Secretary Julian Castro and other leaders from Minneapolis. Our fourth specialization program is in Aging in Place, and this is to help low-income seniors to stay in their homes by offering simple, low-cost, effective tools such as stairway handle railings, grab bars, raised toilet seats, proper lighting, and other mobility improvements, and this is all to prevent falls. And we also offer this Matter of Balance workshop to address the fear of falling and learn fall prevention exercises and strategies. Lastly, our specialization is in healthy housing. SRC has certified healthy home risk assessors conducting assessments and interventions in Hennepin County low-income homes. These assessments evaluate homes on 29 risk attributes including mold, moisture, pests, lead-based paint, radon, asbestos, carbon monoxide, volatile VOCs, and slip, trip, fall potentials, etc. Our whole philosophy is that house is a system. Okay, because of the connection between health and housing, it's just vital, it's very important. SRC does take this holistic approach. We identify energy performance, the energy performance of the home, we identify health hazards of the home, and then also safety hazards in the home. Home is only as good as the health of the family. And as a leader in this home as a system approach, we recognize that home is a special place and it can evoke many different emotions. We've all heard of the famous quotes of home is where the heart is, or as Dorothy's put it in with The Wizard of Oz, there's no place like home. So now on to the grant that we received in dealing with asthma at Maxfield Elementary School. So in 2010, Maxfield School was already partnering with Cultural Wellness, the Cultural Wellness Center and the University of Minnesota on a project to support families in utilizing their culture heritage as a resource for supporting academic success. The university also and this SRC had previously worked together on a variety of projects. So they were sort of like the connection there, and we all came together to apply for the Bigelow Foundation grant. So in April 2011, the Bigelow Foundation granted us $60,000 between the four partners organizations. And the goal was to test a culturally specific asthma intervention process with African American families designed to improve the health of children and enhance learning outcomes at Maxfield Elementary School. Now, the key players at hand, I'll start with giving a little key background. Cultural Wellness Center, CWC, is a community-integrated organization whose mission is to unleash the power of citizens to heal themselves and build community. They focus on experience-based knowledge, community connections, and culture to help people in their health and healing. Maxfield Elementary School is a magnet school. It's located on North Victoria in St. Paul. It's in the Rondo neighborhood. And the University of Minnesota Children, Youth, and Family Consortium partners with communities, agencies to build research, to bridge research and practice and policy. And Sustainable Resources Center, I already gave you our overview, but we were brought into this grant to specifically for our expertise in identifying and remediating home-based triggers of asthma, such as mold, pests, roaches, mice, dust mites, inadequate ventilation of the furnaces, etc. The approach of this grant, we created a multi-pronged approach. Number one was to educate children and their families in school and at home. Number two, to improve communications between the school nurse and parents, specifically as it was related to the children's asthma management plan. Number three, improve the home conditions that might trigger asthma symptoms and by providing home assessments, education, and intervention products. And number four, provide general family support to help the parents and their children stay healthier. And this was basically through support and referrals to other resources. It was our goal that by having this multi-pronged approach, we would create a circle of support to help families in the management of their child's asthma. We really wanted to touch on all aspects of the child's life. The focus of the project, as you know, is asthma. And just to give you a little bit of background, asthma is the most common chronic illness of children. Having asthma often results in increased rates of respiratory illness, difficulty breathing, especially in cold weather or during exercise, general discomfort from the symptoms and asthma attacks, and it can result in missed school days or missing schools or missed work days for parents. It's also responsible for the highest portion of costs due to hospitalizations and hospital visits. And children may experience learning problems as a result of missing school and sleep deprivation due to nighttime symptoms, anxiety, and general discomfort from these symptoms. Add to these complications, there are some additional factors that affect the child's ability to learn and succeed. Some of these include poverty, or living in inadequate housing, but not being able to complain about these conditions due to the fear of eviction, lack of asthma and knowledge and management. And so these complex overlapping social, economic, and physical systems make up the social determinants of health. The next slide is with why we chose Maxfield Elementary, and you'll see the picture of the front entrance of Maxfield Elementary. And the focus of the asthma for this project was in recognition of the major need for health services to increase learning achievement among Maxfield students. In 2011, it was identified as one of the state's persistently lowest achieving schools. Under the direction of its new principal, staff outreach to the community for resources, advice, assistance, and support to improve achievements for its 319 students. At that time, 97% of the students were children of color, and 96% qualified for free reduced cost lunches. Over 20% of Maxfield students had asthma, and this is really important because compared to the Minnesota state average, at that time was 7% for children ages 0 to 17 years of age, and this over 10% within the St. Paul School District. So it was double or even almost 3 times as much the percentage of asthma in Maxfield students. The eligibility requirements for this project was that the child had to attend Maxfield for at least 1 year. The project timeframe was from September 2011 to August 2013, so it was a 2-school-year project. The child was diagnosed with asthma and that interferes with school functions and is taking medicine at the school. And the child was African American or mixed ethnicity. And then also was required that the child was willing to participate in a 6-session asthma management series, and that the family was willing to attend 3 evening educational and support gatherings at school. And there were incentives for these after-school and evening gatherings. They offered $10 to $20 gift cards. So the step one was with Maxfield Elementary. Due to the high rate of students with asthma in Maxfield, they hired a full-time nurse, to do the asthma management care. And most schools only have part-time nurses, so this was not very normal. The nurse then identified children eligible to participate in in this grant, and the letter was sent to families for enrollment. The goal was to enroll 30 families in the 2-year grant. At school, the nurse would monitor to the child's asthma, which included the symptoms, medication, nurse's visits, or visits to the nurse's office, I should say, and absences. Step 2, the Cultural Wellness Center. Some of the specific goals of this pilot project was to create a collective vision of how culture is a resource for health and healing, and to improve the health and to enhance educational outcomes through improving the health of the child. Some of the core concepts underlying the Cultural Wellness Center is that everyone has a culture, and one's community connections and cultural dignity are powerful medicines. They are related to one's personal health and well-being. So the Cultural Wellness Center's family liaison spent many, many hours working with families to build relationships and to establish a trusted connection. They were responsible for the informed consent form, to arrange certified asthma educator, to provide asthma management education sessions, to host 3 family education and support nights, also provide families with the gift cards after the completion of these educational sessions, and then lastly to refer the enrollees to Sustainable Resources Center. And when we received the referrals, we would call and we would schedule 3 visits. The first visit was a 2-hour home assessment, and that included using the Environmental Protection Agency, or EPA, asthma home environmental checklist. And we also included a home visual assessment to identify other healthy home issues. We had an intervention product checklist that we used, and I'll show you a picture of that in the next slide. We also created to every home a specific trigger reduction action plan that we reviewed with the family at the second visit. We did lead testing, and we offered lead education, and we also offered the family an education packet about asthma with asthma brochures, coloring books for the children, to provide them with education about asthma triggers in the home as well as how they could control them. Our second visit included delivery of asthma intervention products. So not only did we go through with what the specific report was with what their triggers were and a reduction plan, but we also offered them an air purifier with high efficiency filters, high quality air filters for the furnace, mattress, dust-proof bed and pillow covers, dehumidifiers, and a dehumidifier and other asthma intervention products. This is very interesting. I felt that the initial idea was that SRC would provide asthma interventions, but the reality was that families needed more organizational items like shelving units and shoe racks, hangers for their clothes, large tubs with lids, and food containers. One family, you remember, needed a shower curtain and a 2012 calendar. We also bought all the families bed sheets and pillows because many didn't have a change of sheets or extra pillows. The third visit was our final evaluation, and this was done 2 to 3 months after the second visit. We wanted to identify whether they were using we did a home inspection of the products, so we wanted to identify if they were using those intervention products and see if some of the behavior changes were made. Out of the 20 homes enrolled, unfortunately, only 11 families received the home interventions. Most of the interventions when we did the final evaluation, were still being used, so that was great. The Swiffer, they loved using the Swiffer, the filters that they changed, bed covers, all of that good stuff. The staff could see that the families were really content with their new items, and they felt a new sense of pride in their home. One family was even so happy with their final cleanup that she invited me to her birthday party. That's the following weekend. So that was great. Unfortunately, though, in some cases, some of the items were lost or damaged. One family was robbed several times, and another family had to evacuate her home immediately, so she didn't have any time to pack up these new items. All of this process of the first visit, second visit, third visit was a tremendous amount of work, and it took a tremendous amount of time due to cancellations. The contact information was constantly changing, and just trying to reach the participant at the right time to talk to them and schedule appointments was extremely challenging. So in this slide, you can see the pictures of the Environmental Protection Agency, EPA's asthma home environmental checklist. We use that as a standard. And then we also have a picture here with intervention products, and we would just use this as a check-off list. And you can see the different items that we also added on, such as a walk-off mat, shoe rack, child-proof kit with electrical plugs, door protectors, all of that for safety reasons, smoke detectors, CO alarms, fire extinguisher, and then the cleaning kit for the kitchen. And then every family received an integrated pest management kit, IPM, which would address some of the roaches or mice It included caulk with caulk gun, gels, roach baits, mice traps, etc. And then the educational packet there you can see included information about asthma. It's a training workbook, how your house works, so that's more on the weatherization side, ventilation, a guide for creating asthma-healthy homes, and other fact sheets, other asthma trigger fact sheets. All right, so I'm going to show you two slides. The next 2 slides will include sample families, and really out of the 20 enrolled families, of the pilot project, these 2 families the situations can be replicated or compared to other homes that we visited as well. So in the sample family 1, there were smokers that smoked inside the home, and most of the homes actually did have smokers inside the home. There was a lot of clutter, and we asked permission, and we had the family actually allowed us to rent a large disposable container and to discard some of the items in the basement. Some of the items were probably left over from the old tenants. It was an old sofa, bags of moldy clothes, a broken desk and chairs, all of the items that cluttered. And with this new clean space, we were able to put up shelving units and pack some of their items in large plastic tubs with lids in there, and they were greatly appreciated. It was greatly appreciated. They also had lack of ventilation that creates mold and moisture problems, and so we were able to move some of the furniture away from the vents that were blocking those vents. We gave them the IPM kits to address some of the pest problems like roaches and mice. And this family actually had 4 cats to control their mice problem. And this family had 1 king-size bed with no sheets and no pillows. The mother slept with her 2 children. And there was only 1 blanket, and all the clothes were kept in plastic garbage bags. They had problems with break-ins and had several things stolen, including her fan, TV, electronics, and other items. Sample family number 2 had an issue with a non-responsive landlord. Many times these families are renting, and landlords, they say that they're going to fix the problems, but they never do. So families live in inadequate housing and poorly maintained due to the non-responsive landlords. This family also had smokers, we also saw clogged furnace filters, no ventilation, fan in the bathroom or stove, or above the stove, water damage and moisture, mold in basement, high lead levels in the old wooden windows, and lots of clutter. They had to move several times during the school year and became homeless 3 times. And the woman had 3 children, and she was also in an abusive relationship. So these 2 family samples provide us details about the incredible challenges that some of these families face, and also the value of providing a continuum of services to these families who many times they're willing to go that extra mile to help their children be healthy and to do better in school, but due to these other circumstances, they are not able to succeed in helping their children. It is critical. The Cultural Wellness Center liaison played a vital role really in providing access to other resources such as jobs, housing, and food. In this particular family, the liaison helped parents this woman find unemployment. So the mother went from unemployment to employment. They also were able to address medical problems that the family needed. And finally, at the end of the summer, 2013, this family had stable housing. So on to the results of this project. We had hoped for 30 enrollees, but we did enroll 20 Maxfield students over the 2 years. By the end of the project, 9 out of the 20 had medicines added to their new asthma action plan. 10 children began taking medicines daily at school to increase compliance. And overall, we saw students students said that they became more confident in recognizing their breathing feelings and what their breathing feels like in order to get the proper medicines. 11 families received home interventions. And those were all like primary outcomes. But the secondary impact of this project, which I think went beyond the 20 families enrolled in this project, was that the whole school community felt more engaged. Maxfield experienced a 350% increase in the number of parents who participated in annual goal-setting conference for their children. So we went from 27 to 122 parents that participated in the annual goal-setting conference. Likewise, school family night attendance grew from 64 families to 81 families, and that was a 27% increase. So all of this was the secondary impact from this project, and this could be attributed due to all the recruitment efforts and relationship building from the school principal, the staff, cultural wellness center, the staff, and the liaison, and that all of that grew and crossed over to the families that were not enrolled in the project. Our biggest challenges, and this was just overall, the biggest challenge was that there was a 60 to 70% turnover in students over the 2-year study. This was alarming to see. The lack of consistency affected recruitment and retaining and tracking of the project, and some of the students had been in 2 to 3 different schools. So very alarming. So given this small sample and incomplete data, the project team, we changed our focus for program evaluation. However, we gained valuable insight of the multiple and complicated barriers faced by Maxfield students and their families. These are some of the themes and lessons learned, and I've divided them into 5 different categories. The first one is that relationships matter. Recruitment and retention of families was significantly more difficult than we anticipated, and the success to recruitment was dependent on the relationships that the nurse and cultural wellness center formed with the students and families. Rather than taking a passive approach, which was like just passing out flyers to get recruitment, which was basically ineffective, they changed to a more active approach with being present at school, introducing themselves to the parents, that personal invitation, invitation inviting them to participate in this program. Another theme which is critical was that education meets the family where they are versus having a rigid curriculum. This includes listening and responding to their concerns and interests, and then you can gently guide them towards asthma education, and that's more readily acceptable and appreciated. And this is critical for anyone doing in-home visits and community health workers working with families. Another lesson or theme was that each family required a different approach and level of investment, making it difficult really to standardize in intervention protocol. And as public health staff, this is really also very important to be aware of. There is no cookie-cutter approach. Families' participation in this Circle of Support project also was a gateway to establishing a connection to other important services and resources. Addressing families with basic needs can be the relationship builder that opens a door for expanding services to interventions around health and education. The second theme with dealing with high-risk families is that we saw that many families had significant barriers. Basic needs were not being met related to housing, lack of employment, food and violence, etc. Their children's education and health and promotion really just took a back seat to these immediate urgencies. So the urgent drives out the important, okay? And then the greater need was anticipated for organizational aids. As I mentioned before, these were relatively simple, inexpensive solutions, such as storage and to store their clothes and toys, all of that, but it greatly improved the morale of the family and their sense of control and order in their lives. A third theme and lesson was with this substandard housing conditions. Pests, we learned that pests, mice, roaches were an overall problem, and all homes received integrated pest management kits. We also did a lot of education about using safer, less toxic options like this integrated pest management versus the foggers or sprays, which can be very toxic. In evaluating behavior change, that's a very difficult thing. We learned some of the habits are very difficult. Smoking is an important asthma trigger, yet it is the hardest behavior to change. So we offered education about it. We offered alternative options, offered examples such as smoking outside the home rather than inside, or opening up the windows, or possibly looking into some of the health plans as incentives to quit. Effective approaches to housing intervention also included involving the family, and this was also a really important lesson learned by SRC, by all of us, because initially SRC staff shopped for the intervention products, okay, and then we started involving the family to shop, okay, so that they would have more control over those consumer decisions. Many learned to compare prices and read product labels. I remember one situation I was discussing with a woman, non-toxic natural cleaning supplies versus a more toxic, heavily scented product. And the woman said, "I love my Clorox and Febreze, and I'll never give it up." And so that was, again, difficult, an example of how difficult it can be to change behaviors. As far as interventions, and this is something interesting that we learned, there is a sweet spot, and finding the sweet spot is difficult. There's likely that the sweet spot where interventions can make a big difference, okay, for families who are in a more stable economic situation, okay, versus a family who's really struggling to make ends meet. Those interventions won't always make a difference. The other thing that we found is that the cost of these interventions were extremely high. The average cost per family was about $675, and it was only possible really through the in-kind time and resources that all four partners provided that we were able to make a successful end to all of this project. Overall, I feel that this was a valuable project, and we learned many important lessons. As a public health specialist, and for many of you who are in the health field and working with families and doing in-home visits, I'd like to leave you with 4 takeaway messages and some fun analogies or visual pictures that you can remember these 4 takeaways with. Number 1, be flexible. You may start out with a plan and specific objectives, but it's really important to adjust as needed. For example, you may set your GPS on the right direction, but you'll need to adjust it if it's taking you into a lake. Number 2, basic needs come first. We couldn't have done this research project without addressing the primary needs of the family. And a fun analogy to remember that is you have to stop the bleeding before you go to the hospital. The third takeaway that I'd like to leave you with, and very importantly, is that every family is unique. You need to meet the families where they're at. Don't forget to listen to them, ask open-ended questions, and respond to their concerns. The takeaway, the fun analogy, is that personalization is more important than the cookie-cutter approach. And lastly, I want to stress the importance of relationship building, and that really matters. Building trust and a connection for a successful health outcome. The key analogy there is don't go solo, because relationship building matters. All right, well, with this is the end of my presentation. I want to thank all of you for attending, and let's go to questions. Okay.
our first question is, what is an example of how staff would state smoking in the home as a primary trigger?
Mm-hmm. Okay. Well, let's see. This smoking is an important asthma trigger, and let's see, an example of staff would state smoking in a home asthma trigger, and we would go in the home. It is a vital thing. Dust mites being one of them. We use the EPA's checklist, the Environmental Protection checklist, to review that. And smoking is a trigger. A lot of times it's a secondhand smoke that is the mixture of the smoke from burning and that gets inhaled by the child, and so it's harder to breathe, and these children are already at a high risk. They have already problems breathing, so I think it mainly deals with the secondhand smoke that affects it. Mm-hmm. And we also worked with, the other question is, did you work with landlords, especially with pest management? Yes, all of these families we worked with the landlords. We reached out with them. In some cases, we did meet with them, and we addressed all of these healthy home issues. Some of the landlords were willing to work with us, and others, they were not so cooperative. But we did what we could in addressing that. Mm-hmm. I'll give the microphone to Kathleen, but please feel free to reach me if you do have additional questions.
Thank you. So with that, I think we're running near the end of our time, and I'm not seeing any more questions coming up on the chat box. So Rochelle, thank you so much for your thought-provoking presentation. It really illustrates the importance of considering and addressing social determinants of health when working with children who have asthma and their families. This highlights the role in which the community health worker may also be able to assist these families. Thanks very much to all of you who have joined us on the line for the webinar today. For those of you who have registered for this webinar, the link to this recording will be sent to you, and others may view it on YouTube once it has been uploaded. So once again, thanks to everyone, and have a good weekend. Bye.